Hello, everyone. Dr. Branson Collins here. I want to bring to your attention this recent publication in the American Journal of the Medical Sciences from October 2025, which was led by one of my colleagues, Dr. Larry Afrin. This was looking at the utility of glucagon-like peptide 1 receptor agonists in mast cell activation syndrome. Now, mast cell activation syndrome is a collection of illnesses which is rooted in inappropriate mast cell activation with little to no neoplastic mast cell proliferation, which distinguishes it from mastocytosis. The interesting part about things is that this can be a great mimicker. It can present as challenging to treat chronic pain and also challenging to treat mental health conditions like anxiety, depression, and insomnia. This is a case series, and they looked at is they looked at 47 cases with a mean age of 39, age range 15 to 71. 89% of demonstrated of these cases demonstrated clinical benefit with the use of a GLP-1 agonist to treat a broad range of problems associated with MCAS. So it certainly lends itself that additional studies, controlled trials that are randomized, should be done to see if we can have another indication for the use of these GLP-1s. And I just want to highlight this particular first case and even the second case. But this first case was a young man who presented upper limit of normal for weight to height and presented at the age of 18 with chronic multi-system inflammation, which was present since early infancy. This was showing itself as dominant frequent upper respiratory tract infections, migratory tendinitis, and spotty arthropathy. So you also had spinal presentation and chronic spine pain, diffuse hypersensitivity of his skin, cold urticaria, and also in puberty, migratory abdominal pain, migratory pruritus and itching, anxiety, panic attacks, depression, and temperature dysregulation. Now, fast forward, a very prudent clinician, when this person was 24 years old, on top of doing the foundational things to treat what they suspected to be MCAS with things like the histamine blockers, he also started a low dose of semaglutide at 0.25 milligrams. Within hours, his hunger and blood pressure had normalized. His fatigue, brain fog, and all of his inflammatory issues were substantially reduced. This dosing was gradually increased, 0.25 milligrams every 4 weeks, likely over the next few months, with additional benefits. And what was very interesting to this is that this particular clinician was monitoring mitochondrial function testing. Things like beta deoxyguanosine could be monitored and actually noted improvements in mitochondrial function based on this testing. And there's another supplementary part to this where this particular individual was stating in his testimony that this was the first time in his life. And again, he was presenting with these issues since infancy. This was the first time in his life that he actually felt like a normal person and that his ceiling of benefit was so high and that the majority of his symptoms have resolved with the addition of this low dose of this GLP-1. And it's just pretty fascinating and the use of these GLP-1s. And I recently did have a visit with one of my clients from the Northwest, very similar, likely had some MCAS contribution, presenting with anxiety, perimenopausal symptoms. And when I added in a microdose of semaglutide, and for her it was only 10 units once a week, even with that, she started noticing improvements in anxiety, sleep, and also reported that her relationship with food was also improving where she wasn't getting as much glucose dysregulation. So it's a very interesting article.